My interest in this is actually kind of driven by personal experience, as it is for many. As my mother was going through her end of life process, I was called out of a meeting to have a shared decision making meeting, and it was a surgical oncologist who went through kind of where things were over 3 minutes and 35 seconds. I know because I was on the cell phone. And, after the sort of discussion was over, I called back to my parents and said, well, that was a nice recap of, the discussion you guys had. And it turns out there was no discussion, that the 3 minutes and 35 seconds was kind of the entire thing. And it wasn't a discussion that involved sort of the values of my family, right? And so how amazing that P. Corey was, funded the original work that looked at kind of putting advanced decision planning, advanced sort of decision making into hemodialysis clinics, which is the population that I work with.
So I think sometimes it's hard for dialysis teams to figure out how to start these conversations or where to begin. And we're talking about the colleagueship, the teaming of the nephrologist and the social worker, and the nephrologist giving kind of this warm handoff, but really having the social worker be the lead. I wonder, Liz, if you want to talk a little bit about how we see that happening in the dialysis center and the kind of training we're going to give social workers.
Sure.
Just jump in for 1 second.
Yeah.
And hand off. I guess for me, kind of one of the joys of working in dialysis is being part of a team. And, we are very lucky in the US to have a team that includes, nursing, tax, as well as social work. And the whole team can be involved. And I guess for me, as kind of a busy clinician administrator, like it's great to have the opportunity to kind of hand off some of these discussions to a social worker who's probably better trained than I
am. Yeah, I agree that one of the most beautiful things about working in a dialysis facility is that we get to draw on all different kinds of skill sets. And, I think that it's exciting to imagine a scenario in which we have, a doctor, a nephrologist who can really give us information about how disease is going to look and what to expect in that and, how to treat that. And then having the social worker come in and help back up some of that communication and then kind of share with the family what all of the options are, and really do that in concert with a conversation around what is it that a family or patient really wants? What are their goals and values around their life, and how can we design your medical care in such a way to support you in that way? The training is going to be around how do you have difficult conversations about this in such a way that patients and family members feel connected and heard and empowered that their healthcare plan is going to be followed. So that training will be delivered over the course of about 6 weeks. And then we will also have additional sessions throughout the next 6 to 9 months to give more information about things like how can you be culturally sensitive and do this? How do you have this conversation via telehealth? How do you incorporate spirituality in this? So we're hoping that we can hit on all those things, and not just in a brain dump kind of way, but how do we work together in an interactive way and learn how to build some skills.
And I would emphasize that interactive part is very much part of our vision of the training, and especially now during COVID, where I think people in healthcare feel sometimes just so cut off and not having support. And this will be we hope this will be one little haven of support in this very difficult time, and just an added boost as people are participating, that they will develop some colleagueship that they can share solutions as well as problems, because that's where the solutions come from, is with each other. Mark, anything you want to say in particular to encourage some of the nephrologists we've invited to participate?
I guess we know from our previous work that when we've talked to patients and caregivers that they value the nephrology presence and input into the process. They don't expect the nephrologist to be the primary driver, but they feel that having that clinical knowledge is important. For me, it's, this is kind of part of the providing the best possible care to our patients so that, they are able to live a life that's consistent with their values, and also, after they pass away, maybe have a family that remains intact because they've already kind of managed the challenges of end of life. So, for me, it's actually kind of part of the fun part of providing care to the dialysis population is working with them, finding out what's really important, finding out how they want to live, getting to know the families. And it's delightful to be able to work with social work to make sure that the sort of key documents are executed, and that we're able to make sure that the patient receives the type of care that they want.